welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and let's look into today's reports. Vitamin B12 deficiency linked with narcolepsy. Narcolepsy is a chronic sleep disorder primarily characterized by excessive daytime sleepiness, cataplexy attacks, sleep paralysis, and even hypnagogic hallucinations, which affects many individuals. Whether changes in the serum vitamin B12 levels are involved in the pathophysiological mechanism of narcolepsy, however, still remains unclear. The study aimed to assess whether vitamin B12 levels are independently related to the occurrence of narcolepsy. The findings that have been published in Clinical Neurology and Neurosurgery reported decreased serum vitamin B12 levels are independently associated with the development of narcolepsy, which illustrates the complex relationship between B12 vitamin and narcolepsy. However, future studies are definitely needed to explore whether vitamin B12 supplementation can improve the symptoms of such patients. Inflammatory myocardial disease presenting as a fulminant heart attack. Inflammatory myocardial disease has been defined by the WHO as myocarditis with cardiac dysfunction. Now, myocarditis is nothing but an important consideration in the differential diagnosis of unexplained heart failure, and even endomyocardial biopsy might be the key. The review in cardiovascular pathology reports heart failure with CD68 predominant inflammation. Histiocytic myocardial inflammatory disease occurs with variable clinical presentations and outcomes, and may be even primary or secondary. However, in some cases of such a condition, features suggestive of antibody or complement mediated myocardial injury and histiocytic myocardial inflammatory disease is a diagnosis distinct from those in classification symptoms currently in use. Prevalence of vitamin B12 deficiency and its association with metformin-treated type 2 diabetic patients. The International Diabetes Federation has identified Middle East and North Africa regions are having the highest comparative prevalence of diabetes in 2019 because of rapid economic development, urbanization, and changes in lifestyle patterns. Now, metformin, as we all know it, is the most commonly used drug in type 2 diabetes, and it may lower the B12 status as a use consequence. A cross-sectional study in Human Nutrition and Metabolism Journal stated that the prevalence of vitamin B12 deficiency in patients with type 2 diabetes using metformin was 17.5%. The risk of this relationship might further increase with longer metformin use and is influenced by the occurrence and duration of the diabetes condition. Weakened alcohol consumption associated with diet variables, body mass index, cardiovascular risk, and sleep. Lifestyle changes and conditioning factors such as diet, physical activity, alcohol, tobacco use, and sleep patterns may be protective risk factors that affect the health maintenance and may even trigger the development of diseases. Now, the study linked that weakened alcohol consumption with body mass index, diet, sleep quality, and tobacco use among Chilean university students according to their gender. It was published in Human Nutrition and Metabolism, and where the subjects showed weakened alcohol consumption was associated with an unhealthy diet and insomnia. However, they did not observe an association with body mass index or even abdominal fat. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.